Good morning. I'm Onslow County Manager Sharon Russell. I have with me today Norman Bryson, our Emergency Services Director, Chrissy Richmond Hoover, our Public Health Director, and Colonel Thomas from the Sheriff's Office. We hope you're doing well today and staying safe. We want to address you again regarding our response to coronavirus. First, I'd like to say that we hope that all of you are following all the precautions that have been explained from our public health department and from other media outlets. It is very important at this time that if you are well, you continue to take the precautions that have been advised. You do not need a shelter in place to practice good hand washing, to practice social distancing, and to avoid crowds. If you are sick, it is very important that you stay home. We hope that you will continue to follow this advice to help keep everyone in our community safe. In addition, we would like to give you a few announcements to let you know how our operations are changing. Today at 5 p.m., the Government Center in Onslow County will be shutting down to the public. This is to make sure that both the public and our employees are kept safe. We will continue to serve the public through telephone and online services. Please look at our Facebook for postings on how you can access services through online or the telephone. And we hope that we will still be able to serve you. Again, that's today at 5 p.m. The Onslow County Government Center will be closed to the public. We'd also like to announce that we are continuing to take donations of non-perishable food items and also now of personal protective equipment at our senior services building. We would like to thank two important donors that gave us some personal protective equipment. Coastal Carolina Community College gave a great donation of PPEs for our first responders. And also Jacksonville Tattoo Company has given us a donation of PPEs, and we thank them for that. At this time, I would like to call on Chrissy Richmond Hoover, who will give us our update of our numbers. And I would like to encourage all of you to listen to the numbers that she reports and know with certainty we are providing all of the latest data that we are given. We're reporting all of the test numbers that are returned to us. Some of the laboratory tests are taking longer than we expected, but we are getting that information out to you as quickly as we can. Chrissy?
Thank you, Sharon. So this morning, our numbers are that we have had 4 positives for COVID-19 since the beginning of this event. 2 of those have recovered. We have about 150 negative lab specimens, and we have about 300 that are still pending. The Onslow County Health Department website is updated daily and anytime that we have a change in these numbers. And so you can see the number of positives and the number that are recovered on our website. We continue to stress the messages of social distancing, practicing good hygiene, staying home when you are sick. And we want to also ensure that everybody understands that if you have mild illness, we want you to stay home. You might not need a test if you only have mild illness. Going out and leaving your home to get a test, you could pick up coronavirus if you don't already have it. And if you do have it, you could spread it to others while you are out. Having a test result will not change your course of treatment. You will be advised to stay at home until you are well. And so it won't affect your treatment plan, whether you get that test result or not. So we do encourage those with mild illness to monitor themselves at home and stay home until they can answer these 3 questions with a yes. So the questions for clearance to resume normal activities are, has it been 7 days since your symptoms began, since onset of symptoms? Have you had at least 3 days where you have been fever-free without having to use any fever-reducing medications like Tylenol? And has it been, have your other symptoms been improving? So if you can answer yes to those 3 questions, those are the criteria that we would use to say you are allowed to move back around and resume some of your normal activities. We do encourage you to continue to monitor our health department website, and we are continuing to update that, and we'll share information on there, including our daily counts of numbers.
Thank you so much, Chrissy. I'm going to go now to Norman Bryson, our Emergency Services Director.
Thank you, Ms. Russell, and good morning to everyone. Currently, Onslow County E911, EMS, and our fire services are still operating as normal. We're still providing all of our services. We've had no effects to our personnel and staff, and we're very happy with that to be able to report that. I do want to remind people, if you are calling 911, that we are going to be asking additional questions of individuals of if they are being monitored or if they are isolated because of the COVID-19. And this is so that we can protect our response personnel to make sure they're wearing appropriate PPE. The only times that we will not be asking those questions is if someone is calling in with a structure fire, fire alarm, or wreck, or something along those natures. But this will even include if we're sending out law enforcement, we will be asking those questions so that we can make sure that we're protecting our personnel. The other piece that I have is, Ms. Russell touched on this earlier, is our donations management. Beforehand, we had talked to people about bringing medical supplies here to the EOC, and we're now requesting that those be turned in at senior services. And we're very thankful that they're helping us with the management of receiving of those items. Those items that we're still looking for are medical masks, gowns, gloves, and shoe covers. If you're able to provide any of those to us, we would greatly appreciate it. These are not just for our EMS system. We are also sharing these with our partners such as the Health Department, Jacksonville Fire and EMS, some of our mental health programs, anyone that has patient contact. We're also having to help find these resources for them as well. We greatly appreciate everyone during this time, and we please do ask everyone to please be patient. That's all I have, Ms. Russell.
Thank you so much, Norman. Colonel Thomas?
Thank you, ma'am. Just want to assure everyone that the Sheriff's Office is still up and operating. We're still responding to our calls for service, and we are still patrolling our communities and trying to protect our communities against those who may be wanting to commit a crime or things of that nature. We have had to make some adjustment, obviously, with access to our building. Our lobby is closed. However, we do services through a service window. And some of our non-essential functions that we have been doing, we have suspended until further notice. But all of our essential activities we are pursuing, and we are responding to all emergency calls. I would like to echo what Mr. Bryson said. Please, when you call 911 and request an officer or anyone else, let them know if you do have any symptoms or if there is a situation that we need to be aware of. And if everyone will continue to practice the social distancing and all the safety steps that we have described, hopefully this won't last as long as it could last. And but the Sheriff's Office will be there with you through this, and our services will continue. Thank you, ma'am.
Thank you, Colonel Thomas. I wanted to let all of you know there's going to be a delay today in broadcasting this with Facebook, so we're not going to be able to respond live to your questions, but I wanted to answer a couple of questions that were put out yesterday, some of the points of confusion. I wanted to let you know that as our County Public Health Director, Chrissy is receiving all of the information for cases both on base and off base. So when our Public Health Department announces that we've had 4 confirmed cases of COVID-19, that includes both the ones from Camp Lejeune and the ones that are out in our general community. So I know that that's been a point of concern for everyone. The whole purpose of having a public health director is she is able to pull the information from all of our health providers, from Naval Hospital, from Onslow Memorial, and track the spread of illness in our community. So she is getting all of that information. As we said earlier, there's a delay right now in getting some of the lab testing back. So we may have some more cases come in positive, and it may come in clusters. We may have a few more that come back, but she is monitoring that daily and getting that information out to the public as quickly as we can. I would also like to reiterate to the public, we talked a little bit the other day, anytime Onslow County has any sort of local orders, it only applies to our unincorporated areas. We are working closely with our municipal partners and with Camp Lejeune, and we will continue to do so. We're also in contact with Onslow County Public Schools and working closely with them. We appreciate all that all of you are doing. Please continue to reach out by telephone to those that you know may be in need in our community. And if you're financially able, please continue to support our small businesses by ordering takeout food, by purchasing gift certificates if that's possible. And let's help each other get through this crisis. Thank you so much. And we will do another FaceTime or Facebook Live next week. We appreciate your attention.